This presentation will include an overview of the location, structure, and function of the cerebellum, as well as examples of what can cause lesions in this area of the brain, the effects these lesions have, and the neuroplasticity of the brain. The cerebellum is located at the back and bottom of the brain, immediately inferior to the occipital lobes of the cerebellum, superior to the brain stem, and on the same level, only posterior to the pons. The brain is divided into 3 regions to describe the location of individual parts of the brain. These regions are called the forebrain, midbrain, and hindbrain. The region where the cerebellum belongs is the hindbrain. Other brain parts that make up the hindbrain are the pons, medulla, and reticular formation. The cerebellum structure is divided into 3 lobes: the flocculendural lobe, anterior lobe, and posterior lobe. The flocculendural lobe uses information about head movement to influence eye movement. The anterior lobe is responsible for mediating unconscious proprioception, or joint control. And the posterior lobe is important in the coordination of fine motor skills. This part of the brain is responsible for the coordination of the body. The cerebellum receives information from the sensory system, as well as the spinal cord and other parts of the body. It then uses this information to coordinate the body's voluntary movements. Some of these movements include posture, eye movements, balance, and speech. The relationship between the cerebellum and voluntary body movements is present when analysing a person who has been intoxicated by alcohol. Drinking alcohol directly affects the cerebellum and leads to the body's coordination and movements to be disrupted. For example, an extremely intoxicated person might have trouble walking in a straight line. Therefore, their balance is compromised. Although drugs such as alcohol can temporarily impair the cerebellum, there are many ways that lesions can occur in this area. 3 examples of causes of lesions are thiamine deficiency, gluten sensitivity, and human immunodeficiency virus, more widely referred to as HIV. Thiamine is a vitamin B, which assists the body's cells in the changing of carbohydrates to energy. It also assists in muscle contraction and some aspects of metabolism. This vitamin is present in small amounts in foods such as fortified breads and cereals, fish, lean meats, and milk. The recommendatory diet allowance for a male over 14 is 1.2 milligrams per day, and for a woman over 19, it is 1.1 milligrams per day. Thiamine deficiency is a lack of efficient vitamin B1 in the body, which can lead to Wernicke's encephalopathy. Wernicke's encephalopathy is a neurological emergency which typically involves mental status changes, gait, and oculomotor dysfunction. The presence of ataxic gait suggests that lesions caused by thiamine deficiency are likely to occur in the anterior lobe. Gluten sensitivity is an individual's intolerance to gluten. It can be celiac gluten sensitivity and non-celiac gluten sensitivity. Celiac is an abnormal reaction to gluten from the immune system. People with non-celiac gluten sensitivity have similar symptoms to those with celiac. However, they do not test positive to the celiac test. A symptoms of lesion caused by gluten intolerance is cerebellar ataxia. These neurological symptoms can be reversed through a gluten-free diet. Similar to thiamine deficiency, ataxic gait suggests lesions due to gluten sensitivity would occur on the anterior lobe. As well as diet-related causes, lesions can also occur due to viral infections such as HIV. HIV weakens the immune system. While this happens, infections and cancers are able to take hold. Due to a compromised cerebellum, balance, ataxia, and gait disturbances occur. This virus is likely to cause lesions in the posterior and anterior lobes due to symptoms of impaired balance and gait disturbances. The most prominent effects caused by cerebellar lesions impact the individual's general ataxia, or coordination, in particular, gait and balance. Ataxic gait is fundamentally the act of walking in an uncoordinated manner. Ataxic gait affects people who have the condition cerebellar disease, or aspects of the condition. An example of a condition which possesses aspects of cerebellar disease is multiple sclerosis. Here is a demonstration of what a patient with ataxic gait would look like walking.
Then I'm going to have difficulty walking.
Dysinertia is defined as any disturbance of muscular coordination which results in uncoordinated and abrupt movements. The condition of myoclonic dysinertia may include seizures, spasticity, and the impairment of voluntary movement. Myoclonic dysinertia is an aspect of cerebellar ataxia, in particular, ataxic balance. Because this involves the fine motor skill of balance, it is assumed that a lesion causing this condition would occur in the posterior lobe. Here is a demonstration of a patient attempting to display the fine motor skill of touching his finger to his nose.
Most of this patient's dysfunction is in fact right at the end point when he tries to touch his nose or to bring his finger totally out. The trajectory is not normal, but the trajectory is not the area of maximal dysfunction. This type of tremor can also be seen in multiple sclerosis and other primary cerebellar disorders.
Oxford Dictionary defines neuroplasticity as the ability of the brain to form and reorganize synaptic connections, especially in response to learning or experience or following injury. Reports from 2014 show a prime example of the neuroplasticity of the brain. It was discovered that a woman in China had lived the first 24 years of her life unaware that she was born without a cerebellum. This condition is very rare and referred to as cerebellar agenesis. This woman had a slow neurodevelopment as a child. She could not stand unassisted until age 4, only began walking unassisted at age 7, and her speech was unintelligible until age 6. Another example of neuroplasticity is the recovery, even partial recovery, from brain injuries. There are many techniques for recovery. One for ataxic dysarthria speech therapy is exaggerated consonant technique. This is proven to be extremely effective in speech rehabilitation clinics. There are many possible causes of lesions to the cerebellum and many effects to those lesions. The presence of this variety of causes and effects gives opportunity for neuroplasticity to occur.